Hi friends, welcome to my channel Med Time with Dr. Munir Jan. I am anesthesiologist and intensivist. Today in this slide video presentation, I will be discussing what is peak airway pressure, what is plateau pressure, and what is their diagnostic importance. So very important concept to understand what is peak airway pressure, what is plateau pressure, and their diagnostic importance. So let's begin. Now, peak airway pressure, by definition, peak airway pressure, it is the maximum proximal airway pressure during the respiratory cycle. So, it is actually a proximal airway pressure, maximum proximal airway pressure during the respiratory cycle. Now, in order to understand it more properly, we have to make sure that we understand what is the proximal airway pressure. Now, according to two-modular theory, this proximal airway pressure is equal to sum of pressure arising from resistive component and the pressure arising from the elastic component. Now, what is the resistive component? The resistive component is determined by airway, which is comprised of endotracheal tube and the patient's own airway. Now, second, the resistive component of proximal airway pressure is equal to product of flow and resistance. Increasing either flow through the tube or increasing the resistance of tube, which increases the airway pressure. So simply, this resistive component is equal to flow into resistance of the airway. Now, second, that is the elastic component. The elastic component of proximal airway pressure is equal to volume in the lung divided by the compliance of the respiratory system. Now, increasing the tidal volume or decreasing the compliance will increase the airway pressure. So, if there is increase in the tidal volume or if there is decrease in the compliance, both will add or both will lead to increase in the elastic component, pressure arising from the elastic component. Now, key concept, as I said, as per the two-modular theory, we have the proximal airway pressure is equal to sum of resistive component, that is because of the airway, and the second is the elastic component, that is purely because of the lung parenchyma and the chest wall. Peak airway pressure, as I said, proximal airway pressure, maximum proximal airway pressure during the respiratory cycle, that is what is known as the peak airway pressure. Now, this proximal airway pressure, it is as a result of resistive component and the elastic component as per the two-modular theory. Okay, so elastic component, it is purely because of the lung parenchyma and chest wall. Resistive component as a result of airway. Okay. Now, there are terminologies that we should know. What is compliance? Compliance is simply the measure of stretchiness. Second is the elastance. It is the measure of the stiffness. And third, compliance is the reciprocal of elastance. Now, plateau pressure. Proximal airway pressure at the end of inspiratory pause maneuver is known as the plateau pressure. So to determine or to get this plateau pressure, we have to do the inspiratory pause maneuver. Either it is you have to set the ventilator's inspiratory pause, okay, or this can be done manually to get the plateau pressure. Plateau pressure can be viewed as the maximum pressure during the respiratory cycle in the alveolus. So it is purely related to the alveolus. At the beginning of breath, alveolar pressure is at its lowest. During inspiration, and air fills the alveolus, pressure within the alveolus rises, reaches a maximum level once the entire tidal volume is delivered. That maximum level of alveolar pressure is equal to plateau pressure. So this is the maximum level of alveolar pressure that is equal to the plateau pressure. Now, so we understood the peak airway pressure. It is the maximum proximal airway pressure during the respiratory cycle. Now, for a given flow rate at the tidal volume, that is in the volume control ventilation, we have a given tidal volume, we have a given flow rate. Peak airway pressure, so there will be change only in the pressures, okay? Now the peak airway pressure will be elevated in the setting of increased resistance or decrease in the compliance. So peak airway pressure will be increased either as a result of increase in the resistance or as a result of decrease in the compliance. Now, in order to determine whether increased peak airway pressure is as a result of increased resistance or decrease in the compliance, an inspiratory pass maneuver can be performed. With this maneuver, after the set tidal volume is delivered, the respiratory valve of the ventilator closes, preventing the air leaving from the respiratory system for a short period of time. So no air can go out as a result of this inspiratory pass maneuver. Now, because air cannot leave the respiratory system during this time, pressure everywhere in the respiratory system equalizes. So there will be same pressure everywhere in the respiratory system. When pressure across the entire respiratory system has equalized, there is no longer pressure gradient to drive the flow. Now, when there is no longer gradient to drive the flow, what will be the flow? Flow will be equal to zero. So there will be no flow. And therefore, as we have already know that the resistive component pressure of proximal airway pressure is equal to flow into resistance. Now, when the flow is zero, what will be the resistive component? It will be zero. Now, thus the measured proximal airway pressure consists only of that which arises from the elastic component. So what you get the pressure at the end of this inspiratory pass, it is because of the elastic component, which is equal to volume divided by the compliance. Thus, proximal airway pressure measured at the end of the inspiratory pass, it is what you get. That is what is known as the plateau pressure. So, in short, plateau pressure is the measure of maximum alveolar pressure during respiratory cycle. Second, measured by inspiratory pass maneuver. Third, higher with increased tidal volume and decreased respiratory system compliance. You can see this pressure time graph where you can see the peak airway pressure and the plateau pressure. Now, peak airway pressure is as a result of this resistive component and as a result of this elastic component. So peak is as a result of elastic component plus the resistive component. You can see this plateau pressure, it is a bit lower than the peak pressure. It is as a result of elastic component. So peak, both resistive as well as elastic components are present. In the plateau pressure, only the elastic component, that will depend upon the lung compliance and the chest wall. Now, diagnostic importance. Peak and plateau pressure as measured during the volume control ventilation can provide information about patient's respiratory mechanics. Elevated peak airway pressure is as a result of elevated pressures from the resistive component, or it could be an elevated pressure from the elastic component, or it could be both elastic or the resistive component. To determine the etiology of elevated pressure, an inspiratory pass should be performed to measure the plateau pressure. Now, if the plateau pressure is normal, the elevated pressure is due to the increased airway resistance. And what are the reasons for increased airway resistance? It could be as a result of biting of endotracheal tube. Patient is biting the endotracheal tube. Or there could be some blockade in the endotracheal tube as a result of thick secretions. Second, airway secretions, and third is the bronchoconstriction. So all these three reasons can lead to increase in the airway resistance and thus increasing the resistive component of the proximal airway pressure, leading to increase in the peak inspiratory pressure or peak airway pressure. Now, if the plateau pressure is elevated, the elevated pressure is due to decrease in the respiratory system compliance or increased lung volume. So, if you have done the inspiratory pass maneuver, because there was the peak inspiratory pressure was on the higher side, okay, now you are getting the elevated levels of the plateau pressure. So this plateau pressure, either it could be increase plateau pressure, either it could be as a result of increase in the volume, or it could be as a result of decrease in the compliance. Now, what are the reasons for decreased respiratory system compliance? It is because of the pulmonary edema, pulmonary fibrosis, pneumothorax, atelectasis, gas trapping, ascites, obesity, and pregnancy can also lead to increase in the plateau pressure. Now, there could be also a decreased peak pressures during volume control ventilation, and it can be noted in the setting of patient's inspiratory efforts or endotracheal tube cuff leak. So you can have this peak airway pressure on the lower side. Now, what could be the reason? It could be either as a result of cuff leak, or it could be because of the patient's inspiratory efforts. Now, because the flow is set in the volume control ventilation, what we have, flow is set. The only thing that can change is the pressure, isn't it? So patient's inspiratory efforts will not alter the flow because flow is already set, but will reduce the proximal airway pressure. Now, this cuff leak can occur because of cuff underinflation. Second, Keffel head migration, that is the upward migration of endotracheal tube, or inadvertent intratracheal placement of gastric tube. And the last, it could be as a result of defective endotracheal tube cuff. You can see these figures where in first plateau pressure and the peak airway pressure is okay, normal, and in second the plateau pressure is on the lower side, peak pressure on the higher side. In the third, you can see plateau pressure on the higher side. Now, to make it more practical, when you go to the patient, where if you see the patient is having increased peak airway pressure, patient on ventilator showing increased peak airway pressure. Now this peak airway pressure increase, either it could be as a result of resistive component or the elastic component. So in order to get it more precise, whether it is because of resistive or it is because of the elastic component, you have to make sure that you do the inspiratory pass to get the plateau pressure. Now you are doing the inspiratory pass, you are getting the plateau pressure on the normal side. Okay, now this increased peak airway pressure is because of the resistive component, and the resistive component reasons could be either because of the biting of endotracheal tube by the patient, or it could be because of the excess secretion, or it could be because of the bronchoconstriction. Okay, now if you are doing the inspiratory pass, then if the plateau pressure is on the higher side, it could be as a result of decreased lung compliance. Now there are a number of reasons for decreased lung compliance. First, in the patient of ARDS, pulmonary edema, pulmonary fibrosis. So you have to make sure that this, by doing this inspiratory pass, you will get the plateau pressure and you will know exactly what is happening in the patient. Thanks for watching this video. If you like this video, please subscribe to my channel and press the bell icon. Please give your feedback. Your feedback is very valuable for me and it is going to help me to improve my upcoming videos. For more updates, you can follow me on Facebook and Instagram by the name dr.munir.jan. Thank you very much.